Welcome, everyone. I'm Dick Deming. I'm Medical Director of Mercy One Cancer Center and the founder of Above and Beyond Cancer. Welcome to our weekly cancer education series. It's brought to you in part by a grant from the Iowa Oncology Society. And our topic tonight is vitamins, minerals, and supplements, and other things we want to talk about. And our guest is Nick Lehman. Nick is a doctor of pharmacy and professor of pharmacy at the Drake School of Pharmacy. So welcome, Nick.
Thanks for having me.
Great to have you here. Nick is also a colleague, so he sees our patients at the Mercy One Cancer Center and provides guidance, and we'll talk about all of that. But before we do, let's get to know you a bit.
Sure.
Nick, where did you grow up? Where were you during high school days?
So I grew up in Dyersville, Iowa. Okay. So the only way anybody ever knows it, it's the home of the Field of Dreams.
Yes. So when were the Field of Dreams? When was the movie?
So it was the late
to your education.
Late 1980s. So I was probably 10, 11 years old.
Oh, wow. That must have been a big deal.
It was a big deal, yeah.
And I forget, it was a lot of the movie actually filmed on location?
It was. So a lot of it was filmed at, and the field is still there today out in the kind of the cornfield outside of town. But a lot of it was filmed on site at the field there, and then kind of Dubuque, Galena, Illinois, kind of the surrounding.
Are you in the film?
I am not, no.
Okay.
No.
Do anyone
there
you know
are,
extras
yes,
in the
there
film?
is. Actually, my high school basketball coach is one of the the White Sox players. It's like as they're kind of walking out of the cornfield, you can pick him out. So there are a few local people that made it as an extra, but I was not one of them, no.
And how many in your high school class?
So I went to Western Dubuque High School. So I graduated with, I think, 180, 179.
Okay.
I know we were talking about class rankings earlier, and I won't say what mine was.
Okay, but what was your personal claim to fame?
So I was the quarterback on our high school football team.
There we go.
Our senior year, we made it to the state playoff semifinals, so got to play in the Unidome, which is kind of a cool experience. So I don't know that that's much claim to fame, but that's all I got.
No, that's a claim. Yeah. Did you date the homecoming queen?
I did not.
Okay.
No.
No, but that's cool. Yeah. And then where did you go to college?
So I went to the University of Iowa, both for kind of my pre-pharmacy and coursework, and then my pharmacy school. So I was there for 6 years, did a residency for a year after I graduated at the VA hospital in Iowa City, which was a great experience, and then worked at the university hospital for about 5 years before my family and I moved here to Des Moines.
And did you know when you started at the University of Iowa that you were going to be a pharmacist?
So I went in as a pre-pharmacy student, so that was kind of my major. But I tell students now, I don't know why I picked pharmacy. Didn't have any family in pharmacy, had never worked in a pharmacy, just thought maybe I'd like to do something health care related, but wasn't really sure on medical school. So somebody had suggested pharmacy, and I was like, oh, sure, why not? And 23 years later, I guess here I am. So it worked out.
And most people, so I've got my best friend from high school became a pharmacist, and I graduated from high school in '72, and back in those days, it was pretty much a path to being a retail pharmacist. A lot of the residency programs didn't really exist, and that was pretty much everybody going in it. And back then it was 5 years, and it wasn't a PharmD. So it's changed, and obviously it's 6 years now, and you come out with a doctor of pharmacy. But there's also many more career paths for pharmacists now. So you mentioned that when you graduated, you had your doctor of pharmacy, but that you did a residency, and that was at the VA. And was that considered like a inpatient pharmacy residency, or was it a particular specialty?
So it was primarily ambulatory care, so more kind of a clinic-based, I think similar to, not exactly what we do at the Deming Center, but kind of a similar role in just patient education and patients who are being seen in a clinic, primary care clinics primarily. But we got a geriatric clinic for older patients, kind of that multidisciplinary team-based approach. So it's just a way to get kind of some more clinical experience. Like you said, there's only about a quarter of our graduates now go into kind of traditional retail pharmacy. 50% do some sort of postgraduate training, so residency, fellowship. Kind of the other 15 to 20% go into more traditional hospital-based practices. So there's a lot of options kind of other than the traditional retail pathway. So that residency just gives you a little bit extra exposure, experience, specialty in that area.
So besides the retail pharmacy, so working in a pharmacy that people would go to get their outpatient prescriptions, what are considered some of the other major career, I mean, within hospital pharmacy? I know oncology, they have their own pharmacists. There's probably other specialties that are kind of known for having their own pharmacists.
Yep. So a lot of our students that go on and do kind of that extra training, residency or fellowships, do exactly what you described. So you're working with more of a specialty service. So oncology is typically a 2-year residency program, and then you work on an oncology floor or in an infusion center to do that. There's options in infectious disease, critical care, emergency room care, ambulatory care, which is kind of what mine was in. So yeah, it's more of that specialized service or specialized education. And then they kind of are embedded with that particular service or team. They may round with the doctor, the nurses, the medical team up on a floor. There's still the traditional hospital pharmacy where you're filling medications, making IVs, antibiotics. There's that dispensary role as well. But oftentimes our students that go into the residency fellowship programs, it is more of that team multidisciplinary care and kind of being involved in that process.
And back when chemotherapy was just getting going, it was often, the mixing of the chemotherapy and the right doses and the bags and everything. I don't know if that's still something the pharmacists do, or if that's something that has become more automated, or more of that the pharmacy techs do, or do the
Yeah, so there's, I think like you said, as kind of oncology has progressed, and this is true of other specialties too, but it has become a much more specialized process. So, they're generally made in a clean room with a very specific air filtration to prevent any contamination. So the clinical pharmacist is probably outside of that role. Like you said, it's maybe a specialized technician who's doing the preparation. There's a pharmacist who works in the clean room, in the IV room, to inspect, ensure, double check that everything with that product is correct. So I think pharmacy, in terms of the specialties, have kind of gotten out of the preparation side of things. But you're right, it's still a lot of monitoring labs or ensuring the dosing is correct, and monitoring for side effects and things like that.
So in the Mercy One Richard Deming Cancer Center, Nick provides direct service to patients. We don't do infusions up in the area I'm in, so it's part of the integrative oncology and patient support services. And so the services that we provide the patients include everything from touch therapies like massage therapy, acupuncture, chiropractic, Reiki, reflexology, but also counseling services like mental health counseling, nutritional counseling, spiritual counseling, music therapy, art therapy. And the role that Nick plays is to provide patients with counseling. And when I tell patients about Nick and the service he provides, I say, any questions you might have, like questions about the drugs that you're taking for your cancer, or about the side effects, or about other prescription medicines, or if you have questions about vitamins, minerals, and supplements. And that's the area that seems to interest a lot of our patients.
Yes, I would agree with that. So you're absolutely right. I think most of the patients we see come to kind of the pharmacy team for questions about things that maybe they've asked their oncologist about, and their oncologist maybe isn't comfortable answering, or they're so focused on managing the patient's cancer, rightfully so, that I think some of the other things, it's easy to kind of fall through the cracks, I think. Our patients are interested in using supplements, herbal products, vitamins. And so that's, I think, the patients that come to see us, that's primarily the questions we get. Although we do get questions about side effects maybe from their cancer medicines, or
especially ones that are on oral ones.
Correct,
that are
yes.
going on.
They're
and
kind of
on
ongoing.
for years.
Exactly right.
Most of them get I would say it's very common and pretty much standard practice that they get an education about the infusions they're going to get. So they've heard about those treatments, but as they linger on with some side effects from either targeted therapies or endocrine therapies.
Yeah, we get a lot of questions on, for instance, women who have had breast cancer in the past and are now taking a pill to prevent a recurrence, and those obviously have some side effects associated with them. So management of some of those endocrine side effects, whether it's a hot flash or helping to prevent osteoporosis. Some of those things we get a lot of questions on in terms of the oral medicines. But you're right, most of the infusion-related questions, I think the infusion center, the pharmacist, the medical team, the oncologist do a great job of providing that information. It's kind of that ongoing management, or
and most of them get a one-page summary
Yeah.
of each drug they're getting.
Yes.
And so they have that in writing. In school, so many pharmacists are now at the point of care. I mean, I get all my immunizations from a pharmacist, and there's lots more clinical work that pharmacists do. In your training, did you get the opportunity to counsel patients and answer questions, and because that's a whole different skill set than taking the pharmacology classes and answering a multiple choice question.
Yep. So our last year of pharmacy school, we do clinical rotation, similar, I think, to what medical students would do your third and fourth year medical school. So we spend 5 weeks at different practice sites, getting those opportunities to work in different practice settings. So generally they'll spend 5 weeks with me in a clinic or ambulatory setting. They'll spend 5 weeks in more of an acute care, up on the floor setting. They still do the traditional retail community pharmacy setting. So it's trying to expose students, I think, as best we can to all the different opportunities within pharmacy. And then, to your point, all the different clinical services that could be provided in those settings. So we try to they get that exposure their last year. We also have them do kind of introductory experiences earlier within their pharmacy school curriculum. So they may spend, I know we've had students spend 3 days with me, just kind of get a sense of what we do in the clinic and what opportunities are out there for rotations, and then when they graduate. So we are trying to expose students earlier to those opportunities within school. I would say too, most of our students work in a hospital or retail pharmacy setting, which I think is great experience and exposure.
And they work as a pharmacy tech,
technician,
getting
exactly
paid
right.
for doing that, but
Yes.
obviously it's also
under the supervision of a pharmacist. But yeah, it's more of a job, but I think it also gives them some good experience in working with patients and troubleshooting some of the issues that patients face in terms of whether it's insurance coverage or cost of medicines or questions on side effects that that come up while they're picking up their medicine. So they get paid, but they also, I think, get a really good experience and exposure to counseling and working with patients in more of a real world setting.
So as one of the professors at Drake, I think your role, and you probably have more than this, but students come to you during their last part of their training where they're actually getting experience. And in addition to our clinic and the Cancer Center, you also are embedded, if you will, in other ambulatory clinics in the city.
Correct.
What
Yep.
are the other clinics?
So we have another faculty member who is affiliated with Unity Point and works actually at the clinic out here in West Des Moines, right on University and 60th. So that's more of an internal medicine clinic setting. So managing more so long-term medical conditions. So a lot of diabetes management, maybe anticoagulation management, just general medication therapy management for that group. We also have a faculty member at the Iowa clinic here across the street who does more medication therapy management, so a lot of more telehealth, phone call follow-ups for patients who are seen in the clinic that need a little bit of extra follow-up. So we, I think, pretty much have a representative in most of the major health systems here. We have a representative at the hospitals doing acute care, at Mercy, at Unity Point, at Broadlawns. And so that's been, I think, a good experience for our students, just to get to see how different health systems work. And, ultimately you're doing very similar things at each site, but it's, there's differences in terms of how clinics operate and how health systems operate. So I think it's a good exposure to kind of get to see how all those different health systems work.
And as everything in medicine that we're doing, interfacing with large electronic medical records,
Yep.
I mean, even just having to go from one system to another
Yes,
and learning all the different
Yep.
systems. I mean, nowadays, these young folks going through school, I mean,
Yeah,
they've been with computers their whole life,
Yep.
and it's probably much faster and easier for them to go to different
They pick it up
systems
quick, yep.
than for us who
Yes.
didn't grow up using
Correct.
those systems.
Yep. I mean, and you were the same way, but when I started, we still had paper charts, and so you'd have to go to the chart room and pull a physical chart for the
Right.
patient.
And try to read the doctor's
Exactly,
handwriting.
Right, exactly, yes. Yeah.
So you can still make mistakes in typing,
Typing,
but
yes.
boy,
Yeah.
trying to figure out numbers and yeah.
Yeah.
So let's talk a bit about the service that you provide for cancer patients at the Mercy One Richard Deming Cancer Center. So every patient that you see will have met with me first, and so I will have gone through their cancer history with them, and then talk about what are the issues that you're experiencing now in terms of either physical, psychosocial, emotional, financial, philosophical, and then we talk about all the different services we have. And as I mentioned at the beginning, I talk about the service you provide. And most of the time that the patients want to meet with you is when we talk about, well, if you have any questions about like vitamins, minerals. I mean, even this, what might seem like simple, like go take vitamin D and calcium. Well, having been recommended that and going to the grocery store shelves, I mean, there are so many different products, even that in and of itself. Which product do you choose? But then we also talk about, supplements, and that can mean different things to different people. For some people, it might mean a supplement that's an herb that might treat my cancer, and for others it's a supplement that might help with my hot flashes.
Exactly right. Yeah.
So maybe describe what a typical interaction would be when you meet a patient in our clinic.
Yeah. So usually, as you mentioned, obviously they start by seeing Dr. Deming, and then if patients have questions about, and like you said, it could range from, we have patients ask about a little bit about everything. It could range from their cancer therapies, whether it's immunotherapy, cancer therapies. We've had patients ask about medications for their diabetes, because obviously that changes. Their diet's changing. Maybe they're on steroids, and that impacts their blood sugar. So asking about diabetes meds and how cancer and supplements impact those.
So let me ask you, at the very beginning, they walk in, will you have looked at my note before the patient walks in?
Exactly.
So you already know.
I kind of know their like you said, kind of their cancer history. Now, sometimes what I think they're going to ask about after reading your note is not at all what they ask about. But usually, like you said, I'll have an idea of kind of what their cancer history looks like. We can access their medication list. We know generally.
How do you typically begin the conversation?
So generally what we'll do is we'll start by kind of going through the list of medications we have on file for them. So with our our electronic medical record, we generally have a list of their medications that I know our nursing staff, when they room the patient in our clinic, will take that. But sometimes patients are seeing multiple different providers, and so they're seeing an oncologist, they're seeing us, they have a primary care provider.
And sometimes those doctors are in different systems.
Yes, exactly right. So they may be seeing somebody from the Iowa Clinic, somebody from Unity Point, somebody from Mercy, and unfortunately sometimes our systems don't all talk to each other. And so usually we'll start by just getting a list of, okay, what medications are you taking? And now that includes, like you said, prescription medicines. It includes over-the-counter medicines, vitamins, herbals, products, supplements.
Although
so we ask about all that
sometimes we're
stuff.
not really good at capturing
Not
those.
at all, no.
Yes.
Correct.
So, I mean, ideally we do capture the prescription medicines. But I would say sometimes when you ask patients what medicines are on, they don't think of
consider
the
that.
over-the-counter
Exactly right.
medicines, and sometimes they forget. And
Yeah. So we try to do a very targeted approach to that. So you're absolutely right. We ask about medicines, and they can rattle off the 5 prescription medicines they're taking, but you're right, they don't mention, I'm also taking calcium and vitamin D, or I also am taking vitamin E to help with my hot flashes. So we really try to...
Ibuprofen 3 times a day.
Exactly right, yeah. Which really, I think, even though it is an over-the-counter medicine or a vitamin, they have interactions with prescription medicines. They have interactions with their chemotherapy medications, their cancer medicines. Some can increase the risk of certain types of cancers coming back. So even though maybe patients don't think of them that way, they really do actually have medicinal properties. They have an impact. They really do matter in their kind of their cancer journey.
So just out of curiosity, so there's a list of medicines in my note. How accurate is that?
It's like you said, the prescription ones are usually really pretty accurate. I think we do a good job.
But we don't
of
do a
tracking
good job of
those.
capturing the over-the-counter ones.
Yeah, and sometimes a lot of patients, I'll look at the medication list, or I'll look at your note, and it'll mention vitamin D, or it'll mention a product, but to your point earlier, it's hard to know, okay, what vitamin D are they taking or how much vitamin D are they taking?
Right.
Some of that stuff, I think,
If
it's
it wasn't
easy.
written as a prescription, it
Correct,
just ends up
exactly.
being
Yep.
vitamin D, but you
and
don't know
that's
what
it.
the
Yeah.
dosage is.
Exactly.
Yeah.
So we try to do a little bit more digging into exactly what form are you taking, how much are you taking, if it's vitamin D, have you had a vitamin D level monitored? So just kind of some of that management that goes along with those supplements and vitamin products. But I would say that's the majority of questions we get are related to non-prescription medicines. And generally they're people who, have kind of gone through that active cancer management. They're maybe done with infusions. They're maybe, on a maintenance infusion or taking a pill daily or every 3 weeks or whatever that looks like for them. But it's generally patients who have had some side effects or, they're like, I'm done with the infusions. I want to get back to feeling myself or feeling better. So a lot of the questions we get are in regards to that, or what can I take to help with some of these side effects, or what can I help to, again, just kind of feel better? Can I get back to myself, what I was like before kind of this cancer journey started?
So I've never asked you this before, but I'm interested to, when they're wanting to know about over-the-counters that might help with some of the side effects, how comfortable are you at making recommendations specific?
Yeah, it's really hard because I think there's a lot of information out there. Some of that information is not good information. There's a lot of misinformation out there as well. So we really try as we're making those recommendations. A lot of times, unfortunately, I'll just be honest with patients and say, there's not really an herbal product or a supplement that's been shown to be beneficial for this condition. So we'll talk about just more general health, eating right and taking a multivitamin and doing some of those things that we want people to do just to maintain kind of their normal health status. But you're right, like it's hard sometimes to dig through or sift through the information that's out there. And so a lot of times here's the best evidence we have, pointing them to kind of reputable sources for their specific condition. We look at the NCCN guidelines, the National Comprehensive Cancer Network has guidelines out there that include some of those alternative therapies like acupuncture, like herbal products for certain conditions. So we try to refer to those as best we can.
And you have a resource like when you're
absolutely,
meeting with
yes,
them.
yep.
So if they say, okay, what about turkey tail mushroom?
Exactly, yeah. So we use a database that we teach our kids in the pharmacy program. It's called Natural Medicines, that allows you to look up a particular product, look to see what the evidence on efficacy is for certain medical conditions. It also allows you to run it through an interaction checker, both with other herbal products, with prescription products, to ensure that there's no drug interactions with that herbal supplement. There's also a database that's called About Herbs, which is managed by Memorial Sloan Kettering Cancer Center. There's a pharmacist who works in a similar practice setting to what we have here in Des Moines, who maintains a database of, I think, 300 some different herbal products and provides, I think, very factual, very evidence-based information on those products. There's a section for patients. There's a section for healthcare providers. So it's kind of a good resource that I really like because it puts some of that information in patient-friendly language. I always tell people if they're interested in starting a medicine, it's a good place to start. But then it also has information for medical providers, for pharmacists that really kind of dig into, okay, what's the actual evidence? It'll have links to references, so particular studies that have been done. So that's a really good resource as well, just for herbal medications in general. But I think it's always good advice, even though you have access to that information, asking your oncologist, asking your primary care physician, asking your pharmacist, do you think this is appropriate for me? Because everybody's cancer is different.
Right.
Everybody's medicines
And
are
the
different.
reason we have you is that most doctors don't want to answer those questions.
Yeah.
I mean, they don't know the answer.
Right, yep.
And it's easier to say, oh, just don't take that
Yeah.
stuff.
Yep. Yeah, I think that's
So
yeah.
having a resource where, obviously you don't have everything memorized, but
Right.
you have the database there, you can answer their questions.
Exactly, yeah, and
is there evidence?
Exactly,
And
right. Yep.
specifically, is there any known cross-reactivity?
Issues. Exactly
Yeah.
right. Yeah, and I know we've kind of had this conversation, but I think to your point, most of the time in the past, I think we've been very hesitant to recommend those products. Or a patient brings in a supplement bottle and it's always no, just stop taking that. We don't know enough about it to recommend whether to take it or not. And I still say that a lot. I just say there's just not evidence. And maybe I'm being overly cautious, but I think it's better to ensure that we're not making things worse, right? We're not causing additional harm. We're not interacting with their medicine. So I still tell patients, I don't think I would take this, but I really do try to,
Right.
if a patient maybe feels like, I've been taking this, I do think it's helping. If they feel it's helping, then as long as it's not harming the patient, then I think
Right.
then we can say, okay, this is probably okay.
Right, and you talk with them about it, and you look
What are
it
the
up,
risks?
and what are,
Exactly right,
what
yeah.
do we know?
Exactly, yeah.
And
what do we don't know?
what don't
yes.
we know,
Yep.
and what's the likelihood that it might be helpful? Do you get many patients who want to know about herbals that may actually help control their cancer?
Yeah, we get that question a lot, and unfortunately, I tell them there's not a magic bullet, right? There's nothing out there that I would recommend across the board to every patient with cancer to keep their cancer from recurring. There's just not anything out there, and so I try to be honest and upfront with them. Now, there are some things like you said, a lot of the information, a lot of the things we talk about are there herbal products to help manage some of those side effects? So vitamin E for hot flashes, for instance, in somebody who's on maybe therapy to prevent breast cancer recurrence. So there are some herbal products and vitamins that help with some of the side effects, but I try to be upfront and just say there's just no evidence that whether it's turkey tail mushroom or turmeric or ivermectin, there's just not evidence out there to say everybody who's had a history of cancer should take one of these things to prevent the cancer from coming back.
So you mentioned ivermectin. I'm curious how often that comes up in the conversation with patients and how you respond. And then I'm going to ask you about the new law that got signed to law in Iowa about pharmacies selling, is it over-the-counter?
Yeah.
Ivermectin
Yes.
in
Yep.
pharmacies.
In pharmacies, yeah.
But maybe your experience with patients who want to know more
Yeah.
about ivermectin.
Yep. So we get a lot of questions about ivermectin is one of the primary ones we get asked about.
And why
Yeah.
is everyone asking about ivermectin now?
I think it's still a remnant of COVID. I think it was such a big push during COVID that people were starting ivermectin to kind of help manage COVID symptoms that I think then it started to get looked at. Okay, well, if it works for COVID, which I think, again, the evidence on that is still debatable, but I think then they started to think about, well, could it work for other things?
And there was some celebrity, I can't remember if it was Elon Musk or somebody, that said they know of friends that
Yeah.
took it
Yeah.
and it cured their
Cured their
cancer.
right, yes. So I
it's
think there's a
kind
lot of
out
those.
there.
Exactly. There's a lot of that anecdotal evidence out there, I think. Yeah.
And there is research
Yes,
being
yep.
done, so there is theories how worm-killing medicines might be able to kill cancer cells. So there is research, there's studies still being done, but it has become kind of just something going on in the internet out there that makes a lot of
Yeah.
people know about ivermectin
Exactly right,
and
yeah.
ask about it.
Yep. Yeah. So we get a lot of questions about that. And to your point, I think there is, there are some studies done in labs that show that maybe that does have some impact on cancer cells.
Yes.
The difficulty is, I think potentially at the doses that you would have to use, it could potentially be fatal to human cells or normal cells as well. So I think it's balancing, okay, in theory this may work, but at the doses we're giving it to people, is it truly
Yeah.
effective?
When you have cancer cells in a petri dish, it's pretty easy
Exactly,
to kill them.
yes, yeah.
And so pretty much anything, I mean, a hammer will kill them if you hit them hard
hit it,
enough.
yep.
But there are human studies that are being done. So you start off with maybe a lab study that might show some drug it might have beneficial effects, and then you have to do the test in
Yep.
humans.
So I know I saw a study the other day. So Dana-Farber Cancer Institute is doing a study. It's a phase 1 study, so very early on, but looking at using ivermectin. I can't remember the specific type of cancer, but I think that's the good thing for us as healthcare providers and for patients as well, is that we're actually starting to look at these in an evidence-based fashion. Like studies are being done to give us more evidence
right.
to be able to start recommending some of these things or not recommending them.
Plus, it honors the patient question
Absolutely,
rather than say,
yes.
"Oh, for God's sake, stop!
forget it."
Get
Yeah.
off the internet and
Yeah.
don't do that." You say, "Well, here is
Yeah.
the studies that have been done
Yep.
on ivermectin. Here's the studies that are now being done in humans." So, but as of now, there's no studies that show that it is useful in your
Correct.
particular type of
Yep.
cancer, but research is being
yeah,
done.
exactly
So it
right.
honors their question and gives
Yeah.
them an honest answer, and who knows, maybe someday it will be
They will be,
shown.
absolutely.
Yeah.
Yeah. Yeah. And I think that's that I think is kind of the overlying message, or maybe the main takeaway that I try to give to patients is just like you said, and an honest, open discussion with them about here's the evidence. Ultimately, I think it's the patient's decision, right? Like we just give them the best evidence we have, helping them make an informed decision about how they want to manage their healthcare. And so ultimately, it's their decision, but I think just trying to provide them the best evidence we have.
Right,
to help
because
them
if you
make a
just
decision.
dismiss them, then
Yeah,
it
then
sort
it
of
doesn't-
feeds into this conspiracy
Absolutely
theory
right.
that the
Yep.
medical establishment doesn't want you to take it
Exactly.
because
Yep.
we're trying to sell you something else.
Correct. Yep.
What about the new law that got signed in
Yeah.
by the governor? That where did that come from? And so before this law goes into effect, can anyone go into a veterinary pharmacy and buy
I believe
ivermectin
so.
without
Yeah.
a prescription?
I believe so. Yep.
And so now before this law, could you not?
Not at a pharmacy.
You couldn't.
Correct. Now, I think if you could find a physician who would write a prescription for it, it was available to purchase, like a regular
Okay.
prescription would be.
Okay.
I think this law treats it more now as, like you said, an over-the-counter item. I think, and I may be wrong, but I think it's still behind the pharmacy counter. So kind of similar to how we treat like Sudafed or kind of those allergy-based products. So I still think there would have to be some interaction association with a pharmacist, with a pharmacy staff member. But you're right, it no longer requires a prescription.
And
so they
does
can
the
just go
law
in and-
mandate that pharmacies have to?
So I think that was initially included, and I apologize, I don't know if that ultimately passed, but I know in the initial version of the bill, it would require a pharmacist to dispense it, whether they felt it was appropriate or, regardless of the pharmacist's clinical judgment, it would still be, if somebody came in and asked for it, you were required to dispense it to them. And I know our state association was really working to treat it like we treat all other medicines. The pharmacist has a right, if they feel the prescription is not appropriate for whatever reason, to not fill that prescription. And so I think the goal was to treat ivermectin that same way, where if the pharmacist didn't feel it was appropriate, they didn't have to dispense it, but it gave patients that option to just go in and purchase it over the counter.
Okay.
Yep.
Okay. What are some of the other issues that our patients discuss with you?
So I would say those are the main ones. Just what supplements do you think would be helpful for me to take? We also get a lot of questions about, and I think you touched on it earlier, if we feel a supplement is appropriate, how do we help them pick out an appropriate supplement, right? Unfortunately, our supplements, our vitamins, aren't regulated to the same extent that our prescription medicines are. And so there's no real FDA, there's no real organization that oversees, okay, is this herbal product effective for what I want to use it for? Is it safe? We find that a lot of those herbal products have maybe other contaminants. So even though it tells you it's only vitamin D on the label, through testing, we find, there's other things in here that are inactive ingredients that may be harmful for our cancer patients. So it's a lot of helping them identify, okay, vitamin D may be very helpful, or vitamin E might help with your hot flashes, but then how do you pick out a particular supplement? And so some of the things we talk to them about are just ensuring there's third-party testing. Now, it doesn't mean that product is proven to be safe, or that, the claims that are being made in terms of how it's used are studied and researched, but it at least ensures that what's on the label is what's actually in the product.
And is there something on the label that you know has been third party?
Yeah.
What
So
do you look for?
So there's a couple organizations that do independent testing. So one is called USP, it's the United States Pharmacopoeia, where they'll actually partner with the manufacturer, do that testing to ensure, okay, what's on the label is actually what's in the capsule at the right amount. There's no other contaminants. There's nothing else in there. So you can at least have some knowledge that what you're getting is safe. So you can look on the bottle, there'll be a little circle that says USP certified. So that's a really good place to start if you're looking for a reputable manufacturer. There's another organization, it's called the National Formulary. So kind of they do the same thing. It'll have a little circle with NF on there. Other labs will do kind of independent third-party testing, but those are kind of the two would be the United States Pharmacopoeia, USP, and the National Sanitary Foundation, which NSF would have that little circle certification on there that what's in the label, or what's on the label is actually what's in the product. So that's a really good place to start.
Good guarantee. Yep. In general, do you think like most of the brand names like One A Day or Centrum, like those almost would
Yes,
go through
most
that
of those would go
process?
through that process. I know one just from working in pharmacies that we really like is Nature Made, is a very reputable brand that undergoes that third-party testing. And there are other ones out there, so I don't want to exclude those. But yes, like you said, most of the main products, One A Day, Nature Made, Centrum, those type of products will have undergone that testing. Yep.
Okay. Do you ever, as you're in meeting with patients, do they ever ask your opinion about the treatment they're getting in terms of the cancer treatment or the other prescription drugs that they're getting?
More so the prescription drugs. We don't get a ton of questions, honestly, about, is this the right chemotherapy combination or is this the right immunotherapy? I think the patients we've worked with all see an oncologist. I think the great thing about our center is that these products, these herbal products, the supplements, aren't being used as an alternative to standard cancer therapy, right? We're using them in addition as a complement to some of the traditional cancer therapy. So I think our patients, generally the ones that I've spoken to, have a great relationship with their local oncologist. Maybe they've seen a specialist at Mayo or at MD Anderson or at the University of Iowa. And so I think they're very trusting, have a great relationship with their oncologist when it comes to their cancer management, which is a great situation to have. I think we have great local oncologists who do a fantastic job. So we don't get a ton of questions about the actual regimens, but we do get questions about other prescription medicines, and how their kind of cancer therapies would impact their other medications or the other medical conditions that they have. A lot of our therapies can cause hypertension or an elevation in blood pressure. And so kind of working with maybe their primary care doc about, okay, do we need to add a medicine or increase a medicine as they're kind of undergoing this journey with their cancer management. So we do a lot of that as well. But I would say, as you mentioned earlier, our primary questions we get are around supplements, vitamins, herbal products. Yeah.
And just to make clear, we're not selling anything.
No.
We're not even recommending
Nope.
them. We're just a source of giving honest
100%,
answers
yes.
and
Yep.
helping them find the information they need so they
Correct.
can make a decision.
Yeah. I think that's a great thing to point out because we don't offer supplements in our clinic. We're not selling patients anything. It's more so if you would like to start this, here are the things I would look for. I generally don't recommend a specific brand, but just kind of give them guidance about what to look for because I think unfortunately sometimes kind of in the health industry, the self-care industry that I think has sprouted up, to fill some of the gaps I think that we traditionally have kind of shied patients away from. I think there is some of that push to, well, we drew all these labs and you have all these deficiencies and now I'm going to sell you all these products, which, it maybe is helpful and maybe is not. So I think, really try to stay away from that and really just recommend, in general, here's what I would look for if you're looking for a particular supplement.
So as I look around the room, with you as the exception, most of us are probably at the age of the vitamin D and calcium being recommended or talked about. Maybe just start a little bit with how do you talk about vitamin D and calcium and what patients should know? And let's say it's assuming that nobody's ever tested their vitamin D or calcium. They've just been said, oh, you're postmenopausal or you're menopausal. You probably should consider taking vitamin D and calcium. How's that conversation go?
So kind of a good starting point. There's kind of two main forms of calcium. There's a calcium carbonate, which is honestly in Tums. So if you take Tums, you can actually get calcium supplement from that. There's another version called calcium citrate, which sometimes works better if we have people who are maybe on a proton pump inhibitor for like heartburn. So like Prilosec, Prevacid, those types of products, or citrate products works a little bit better in a low acidity environment. So sometimes it's just, okay, what other medicines are they on? What other medical conditions do they have? Helps us kind of decide where we go from a calcium standpoint. Both are equally effective. You can actually only absorb a certain amount of calcium at a time, though. So sometimes patients will say, well, I'm taking 2 calcium citrate or 1,200 milligrams all at once with breakfast, and really you can only get about 500 to 600 milligrams of that at a time. So that extra that they're taking is just kind of, unfortunately, going to waste. So we talk about dividing it up, maybe taking in the morning and one at night to just make sure you're getting the absorption of all the calcium that you can. Vitamin
Why
D.
do the calcium manufacturers have to make the pills
So big?
darn
That's a good
big?
question.
And
Yeah.
can you get just, I'd rather take 3 little ones
Yes,
than
yeah.
one big one.
They do come in different sizes. They do come in chewable. So like Tums, you can actually just chew those and get a good amount of calcium. I know they're starting to sell gummies that are chewable. But yeah, traditionally the old calcium products that we grew up with they're big
horse
pills.
pill.
Yeah. Vitamin D, generally we recommend about 800 to 1,000 units a day. The primary source of that naturally is in the sun. So this time of year, it's a little bit less of an issue if you're outside. You can get pretty good vitamin D absorption, 15 minutes in the sun. But obviously being in Iowa, the Midwest, in the wintertime, where we're not outside a whole lot, generally oftentimes we see some more vitamin D deficiency during that time of year. But 800 to 1,000 units of vitamin D, 1,200 to 15 units of calcium, milligrams of calcium, is really a good starting point for most patients who, like you said, are maybe in that menopausal period or are on certain therapies. Aromatase inhibitors have been shown to cause osteoporosis, so letrozole, anastrozole, those types of things. So ensuring that those folks especially are on a good calcium and vitamin D supplement, I think, is really important.
Okay. We're going to open it for questions. So we have a live studio audience. You get first questions for Nick. If you're watching us live streaming right now, you can put your question in the comments section of the software you're using to watch us right now. So Poon, you get the first question.
Thank you. Nick, would you recommend collagen for cancer survivors, someone taking tamoxifen? And would you recommend what time of day in the morning? And do they take it with other supplements?
Yeah, so, and I can repeat the question or?
Oh, no, she's got
okay.
a microphone.
Gotcha.
Yep.
Okay. So collagen isn't something I necessarily recommend to everybody across the board. I think there is some good evidence. Again, with some of our, I think you mentioned tamoxifen, some of our other breast cancer preventative therapies can cause some arthralgias or kind of arthritis, muscle aches, bone aches, things like that. So I think collagen is generally pretty safe, especially if it's just a collagen supplement itself. Again, I think it's really important to ensure that you're asking your pharmacist, you're asking your physician about that, because it is a little bit different depending on what cancer you have and what medicines you're on. But collagen is usually, I think, a pretty safe supplement that can be taken with most other medicines that does potentially help.
So you don't have your database with you, but is there evidence that collagen helps?
Not a lot.
Okay.
Yeah. I think it's generally pretty safe, but to your point, there's not a whole lot of evidence that it's overly beneficial either. But yeah, I think for the most part, as you mentioned, it doesn't have a ton of interactions. Other people have tried like glucosamine, chondroitin, which has some evidence as well. But there's, unfortunately, with a lot of these things, although it's generally we think they're safe, there's just not a ton of evidence that they're overly helpful for a lot of these conditions.
Okay.
Yeah.
Kevin.
What do you think about the various B vitamins? I mean, I take a B as it's a marker. I know if I took the rest of the vitamins that day. I just look at the urine, yeah. And then if it's clear, hey, I forgot my vitamins.
Yeah,
But are there any B vitamins that you think might be helpful for in cancer recovery or?
Yeah,
just an old person?
So a lot of times we'll recommend, and again, there's testing you can do to look for vitamin B deficiency. So B12 deficiency, anemia, in particular, you can do a lab test for to see, am I deficient in B12? So that's sometimes is a good starting point if you have questions. Maybe starting with a level, a blood check of vitamin B12 is okay. A lot of people take a B complex vitamin, which can include B12, but it also maybe includes B6, some of the other B vitamins that are kind of included in that. And again, if you're not deficient, there's not a ton of evidence to say that they're helpful. And I think you hit on it, like sometimes you just kind of pee those out, right? If you don't need those, you're not absorbing extra, so you're not likely going to overdose, but if you're not deficient, there's not a whole lot of evidence to say that it's very helpful either. You're just kind of get rid of any excess in the urine. Yeah, a B complex is usually okay to take. Yeah.
There's a question, but I want to ask a question first. Is there any vitamin or supplement that you think has overwhelming evidence of benefit that you think people should consider for either normal aging symptoms or side effects of chemotherapy?
So I always tell people there's not, and I wish there was. I wish I had a great answer to say if you have neuropathy or nerve pain from your chemotherapy, you should take this. Some people have looked at B vitamins for that, or magnesium for that, or different herbal products. Acupuncture actually has some really good evidence with chemotherapy-induced neuropathy. So sometimes we'll recommend they go see our chiropractor in the clinic. But there's not a magic bullet, unfortunately. And so it's really having that honest, open discussion with that patient like we talked about, and here's the evidence we have, and then helping them make the best decision they have. But there's not, other than kind of the typical.
What about vitamin E and hot flashes?
Yeah, there's some good evidence with that, especially for our patients with hormone-based breast cancer, if it's estrogen, progestin positive. We obviously don't want them taking estrogen supplements to increase the likelihood of that cancer coming back. So vitamin E is one, I think, that has some decent evidence, and it doesn't work for everybody, unfortunately. But at least I've had some patients say it kind of takes the edge off or reduces it. It's not going to eliminate it, unfortunately, but it's a good, relatively safe supplement for those folks who are struggling with hot flashes. Vitamin E is generally a good starting point. Yep.
Question from the audience.
Mary's watching on YouTube tonight. She keeps a printed list of meds, over-the-counter, allergies, past surgeries, that type of thing, and then takes that with her. Now, my mother used to do that too. She'd have a notebook that she'd take with her, but I always wondered whether or not they were trusting that information. Can you trust that?
I think it's a great idea. And I think because of what we talked about earlier, where maybe they're seeing different practitioners, different providers from different healthcare systems, honestly, the patient having one good list that at least is a starting point, I think is a fantastic idea. So if they have something like that has their surgical history, their medications, their medical conditions, their allergies, absolutely bring that. I think it's really helpful. Now for us, I think as medical professionals, or for me as a pharmacist, I still do verify that. So maybe it's looking in their electronic medical record, or maybe it's calling a pharmacy and saying, the patient has this on their list. How often have they filled it? Or when's the last time they actually picked that up? Because sometimes things get left on those lists. So I don't necessarily trust those 100%, but it's a very good starting point. And I would absolutely recommend everybody kind of having their own personal list of kind of everything that you mentioned, George, because I think it's a really good starting point for us to go off of.
You mentioned the Sloan Kettering having a list of available. I mean, can we access that information?
You can, yeah. So that's a great question. So it's a free resource. It's called About Herbs. So if you even Google About Herbs, it'll come up. It should be usually the first one that pops up. It's a free resource. So like I said, there's a section for patient information that's in more patient-friendly language that kind of talks about some of the evidence that's out there, what it's been used for, what the dosing would be, some of the side effects, some things to ask your doctor or pharmacist about. So yes, a free resource. It's called About Herbs. It's a really good starting point. If I read about this or I heard about this from a group, what's the evidence out there? That's a really good starting point. And again, it's not meant to be all encompassing, but it's a good starting point to then bring that information to your oncologist, to your pharmacist, and have that discussion with them. Yep.
Tim.
Yes, I have a question for you. What do you think about a multivitamin for like a regular person versus a person who has cancer or is a cancer survivor? Because multivitamins have A, B, C, D, E, C, and all this other stuff. Sometimes it's 50% of RDA. Sometimes it's 2,500%.
Right.
I mean, is that good for you or not good for you? Is it better for like a regular person, or is it better for someone who had cancer or has cancer?
It's a great question. So I think for most people, taking just a standard multivitamin, with a Centrum or a one a day, those types of products.
Centrum Silver.
Those I would say are generally pretty good. Now, I think the hard part, and sometimes that we have a discussion on, and I think that's why I've loved being in the Integrative Oncology Center, is even though it's a one-a-day multivitamin, if you look at the label, it has some things in there that maybe I wouldn't recommend for somebody with cancer. So if you're looking for like a general multivitamin, multi-mineral tablet, those are okay. But a lot of them now, we'll say Centrum Silver for energy or Centrum Silver for bone health. And a lot of times they'll have extra supplements in there that maybe aren't indicated or that a person with cancer should be taking. So I think it's always good. the first time you're starting one of those things, bring it up to the pharmacy counter and ask, hey, what do you think about this? Or bring it to your doctor's office, or bring a list and say, hey, here's what I'm taking. Could you look into this a little bit more? Because a lot of times, even though it says it's just a standard multivitamin, there oftentimes are other things in there that are not, probably I wouldn't include in a standard multivitamin. So it's in addition to your normal vitamin A, D, E, C, all the stuff that we think is probably good. But there's also herbal products or other supplements in there that I think it would be really good for a patient with cancer, with a history of cancer, survivor. I think it's really good to have all those things looked at in a little bit more, I guess, specific.
So do you think
Aye.
there is a product on the market that is kind of a simple multivitamin that you could say in general, this would be, if you just want a little something to make sure that, you eat different things every day and some days you don't eat well.
Yeah,
Is there something that is kind of very safe?
I would say look for a product that has the least amount of ingredients possible. So if it has vitamin A, B, C, D, E, that's really about all you need.
But you're a
to-
pharmacist who's been in a drugstore and seen all
All
of
the
these.
different
And I
options,
know you're
yes.
not getting paid. I'm not saying you should recommend them.
Right.
But do you think something like just a plain old
A
one
plain
a
old
day?
one a day is about the best thing. Agreed.
Okay.
Yes. Because I think it has the main things that most people need, and it doesn't have a whole lot of extras in there.
Yeah.
So yeah,
They're
just a
pretty
basic.
much mineral and vitamins. And
Exactly right.
I haven't looked lately, but I don't think there's like herbs in most of
Most of them
those
don't, but I
things
think,
that are-
yeah, if it's just a general multivitamin, multi-mineral component, it's generally just the main stuff that you need. But then sometimes they'll have specific focuses for bone health or for energy or for joint
prostate
pain or
health,
prostate
or,
health.
then
Those are the
you-
ones, yeah,
where
those
you
are the
go
ones I
like,
think where
I
it's.
wonder what's in there.
Exactly right. Those are the ones I think it's important to kind of run by somebody. Yep.
Okay.
But you hit on it too. I think the best advice is as best you can to try to get those nutrients through a well-balanced diet. That's the best way to ensure that you're getting everything you need. And then a multivitamin would just be a good supplement for those things that maybe you're not getting. Yep.
Okay. George, do we have a?
Yeah, I'm particularly interested in one of the categories that has to be most often asked about, particularly for cancer patients, pain medications. A lot of them have fallen into disfavor. OxyContin, obviously, even this, gabapentin? So what is the pain med du jour? What is recommended? And is there anything new on the horizon for pain?
I don't know, do you want to, if you have a thought on this one way or the other, and I can kind of chime in, but.
So I am a big fan of, for patients where there's not a contraindication, non-steroidal anti-inflammatory, so NSAIDs, and the classic would be something like ibuprofen. It just surprises me that how many people think that, oh gosh, that's got so many side effects. And I can personally say if it had that many side effects, I wouldn't be here. And that it's been around for a long time, and it is very safe and effective. And so that I think I'm a strong proponent of something like ibuprofen unless there's a direct contraindication and as an over-the-counter medication. Then when we talk about other pain medicines for general pain, the gabapentin is something that typically is prescribed for neurologic pain. I haven't had many patients who really feel that it's particularly good with, and the kind of matching the effectiveness versus the side effects. So then when it gets to severe pain, then we're talking about going from my point of view, non-steroidals to, you can also add in Tylenol. And I have to say my bias is that I don't get much benefit from Tylenol, so I tend not to recommend it as much as I do ibuprofen. But some people get great benefit from Tylenol, and it's proven to be effective. Then when we get into you need something stronger, narcotics have a proven track record. So you can start with the lower level, like hydrocodone, move up to oxycodone, move up to hydromorphone, and then we've got really good old morphine that is, sometimes that word scares people, but is very safe and effective when prescribed and taken correctly. So those are some of the things that I think of, but I usually start off with a very safe and effective over-the-counter, and that's ibuprofen.
Yeah, I would agree. And I don't think there's anything necessarily in terms of an herbal product or a supplement that I typically recommend for pain, or in particular cancer pain. It's the same conversation: Tylenol, ibuprofen, naproxen. The nonsteroidal anti-inflammatory medicines are generally a very good place to start because they're pretty safe. And I would agree. I mean, I think cancer pain in particular is an area where opioids have good evidence. And I think it's just really having that discussion with the patient, with the prescriber, to just ensure that it's the lowest amount that's helpful, the lowest number of tablets that's helpful. So you're not. I think in the past, unfortunately, we'd just give them as many opioids as they want, and that obviously is a terrible idea. But I still think it definitely has its place for pain management.
And then a discussion of the side effects of sedation and constipation, and that's important to have, because sometimes you do then have to pay particular attention to constipation and how do you mitigate that side effect. I will also say that now, built into the electronic medical records as you are prescribing narcotics is you tap into the national database to see where are they getting other prescriptions. So even if they don't tell you where the prescriptions are, you can see it's mandatory that we keep track of that. So if there's any concern that this is somebody that is seeking out medication, I would say that's not generally
Not
a problem
no.
with
I would
oncology
agree.
patients at all, and that also the chance that somebody in severe pain from cancer is going to get addicted to a narcotic for pain is so small as to not really be something
I would
that I'm
agree.
concerned about.
Yep, I agree. Yeah, and I would agree too. I think we've done a much better job. When a patient fills it at the pharmacy, they have to legally report that so that it goes back to the electronic medical record. There's a database so if they fill it at one pharmacy and then try to go to another one 2 days later and fill the same product, that flags. So I think the federal level has done a much better job of tracking that to ensure that that patients aren't abusing that. But I would agree. I think generally our patients with cancer who need that level of pain control are very appropriate, very knowledgeable about some of the risks and benefits. Yep.
We have time for one more.
So, is there any studies that's been done to show sleep aid over the counter for cancer survivors
So I am
that are safe?
Yeah, so I'm not aware of anything over the counter that has been shown to be beneficial. And actually, especially for older adults, some of those sleeping aids are actually harmful. So Benadryl-based sleep aids with diphenhydramine have actually been shown to potentially contribute to developing Alzheimer's or other cognitive issues down the line. We've had people try melatonin, which for some people helps and other people is not helpful at all. So there's not anything I'm aware of that's just over the counter or an herbal-based product that's been shown to be overly helpful. So we talk a lot about just good sleep hygiene. There are some prescription-based sleep aids available if necessary. But again, there's not something over the counter that I would just say, across the board, here's what you should take. Now, some people come in on melatonin, and usually that's okay if they feel it's helpful. But it's not something I typically recommend to our patients when they come into the clinic.
Okay. Well, our guest tonight has been Nick Lehman. Nick, thank you so much. Nick's a doctor of pharmacy, professor of pharmacy at the Drake School of Pharmacy, and he provides consultation to our cancer patients on vitamins, minerals, supplements, and anything to do with their medication.
Yes.
Thank you so much for being part of this.
Thanks for having me.
If you know someone that would benefit by watching this program again, it's going to be available on demand beginning tomorrow at the Above and Beyond Cancer YouTube channel and also the Mercy Cancer Center website. I hope you'll join us again next week. Thanks, everyone.